Gummy Smiles, you take care of that as a periodontist.
I love Gummy Smiles because that is really dramatic. So if a patient has a gummy smile, that means when they smile, too much gum shows, not enough tooth shows. And these people, you know, they put their hand over their mouth or they put their lip down. They're afraid to smile completely. They have a horsey smile, a gummy smile. Lots of names for it. And they can't really be themselves because they can't, hey, the smile is so important and they're afraid to do it. So we actually have a procedure called crown lengthening where we sculpt that tissue. We sculpt the tissue, we sculpt the bone underneath it because you have to do that if you want to get a great result. And then the teeth look great. The gummy smile is gone. I've had patients, they look in the mirror and they cry, Randy. They cry.
Is that right?
They
Good.
Absolutely cry. It changes their lives so dramatically, perhaps more dramatically than any other cosmetic procedure. I do a lot of gum recession, and that's great, but this just changes their lives because they couldn't smile, they were embarrassed, and it's immediate.
Now, these people that have what appear to be somewhat baby teeth or really small teeth, you say the gums might be giving the illusion that they're small.
In many cases, that's what happens because the gum covers most of the tooth. So the gum covers most of the tooth, so the tooth looks small. It's not. It's a regular, good, normal, healthy, good-looking tooth, but it's under the gum. Nobody can see it.
So are you doing this with a laser, or how are you doing this?
We use the laser, but we typically also use a scalpel because sometimes you can't do it all with the laser, and especially the bone, because you do have to reshape the bone, and the laser is not particularly great or very time-consuming in doing the bone recontouring or sculpting. So we use a combination of a scalpel, and we use a laser to some extent, and we also reshape the bone. It's hugely gratifying, and the patients love it.
What about after orthodontics? Is that a good time?
Well, see, orthodontics is a two-edged sword. Now, people need orthodontics. Your teeth are crooked. They're not in good shape. Absolutely.
Because you love orthodontics, you said.
Look, I love it because it keeps me busy. Another thing about a gummy smile is when people have orthodontics, the braces or the appliances, sometimes it's hard to clean around or irritate the tissue. The tissue becomes overgrown, thickened, and actually causes a gummy smile and can be very disfiguring. So those are typically many of the cases that we do, is to remove and reshape that gum tissue after or at the end of orthodontic treatment.
And you do a lot of this?
I do a lot of it.
So it's called cosmetic periodontology, or what
No,
do
it's
you call
called
it?
Cosmetic Crown Lengthening, or Cosmetic Gum Reshaping, absolutely. And for that, we use a different technique. It's called a lip repositioning or a lip lowering procedure, and it's completely different. So instead of cutting away or reshaping the gum tissue to make the teeth longer, because they don't need to be any longer, they're already plenty long enough, but the lip pulls up too high. It's actually like...
Just kind of tack it up there?
Yeah, well,
or
it's
down?
the lip, we sort of tack it down. Yeah, actually that's what we do. We tack the lip down. Now that has actually two benefits. So besides preventing the gummy smile, because the lip just doesn't pull up as high as it did before, the lip also in all these cases becomes a little fuller. You know, sometimes people get their lips injected. Well, the lip actually becomes a little fuller, so it's a pleasanter looking lip as well as not pulling up so high. I mean, it's a great procedure when needed. Most of the time, we can treat it with reshaping the gum. But in a number of cases, the gum length is good, and we need to bring the lip down.